Hi, I'm Dr. Beth Goldstein, and I've been in practice for over 31 years. And one problem I've seen many times that I wish there was a great instructional video is how to deal with skin tears. These occur particularly on lower legs of elderly patients and arms as well, or anyone who's been on long-term prednisone. So with skin tears, the first thing to do is to clean them up. So you want to use an antibacterial cleanser or something similar. It can be even dial soap. And what you want to do is then dry it with something clean. Gauze would be great to dry it. And then you assess the bleeding. So it is great to have this on hand. You can order it online or get it at your pharmacy, but it's called aluminum chloride. And this is your first line of defense for bleeding, particularly for those patients on blood thinners. So what you do is you either use Q-tips or you use a cotton ball and you will apply it to the wound. You have to kind of rub it into the wound for it to work, and this does sting. But remind them you're helping them stay out of the emergency room. So when you apply it, you have to hold firm pressure for at least 10 minutes. And if you're looking, it's not cooking. So if you're looking every minute to see if it's bleeding, it will still be bleeding. You've got to hold that firm pressure. If someone is on a blood thinner or there's a little bit of a bigger vessel involved, plan on holding that pressure 15 to 20 minutes and then assessing. So if you haven't been able to get it to stop bleeding with aluminum chloride, this quick clot is wonderful to use. Now it's important, if you don't need to use the whole quick clot, to just cut a piece that you need in that strip and hold it in place for about 3 to 5 minutes and then assess where you are. If you're better but not stopped, you can use the other piece. If it's stopped, you don't actually remove it for 24 to 48 hours. Sometimes removing it can cause bleeding again. So what you want to do is apply something like Aquaphor or just plain old Vaseline over it, thick, and then use a non-adherent dressing like Telfa or an equivalent. So when you remove the bandage, it's not going to pull on the wound. And what you should do is wash the area with warm soapy water and try to gently remove that quick clot after 24 to 48 hours. Now, when you're securing this in place with the Telfa, you want to use either a non-stick adherent wrap, ideally, or you can also use this Hypafix Gentle Touch. Now, there's other Hypafix, but the Gentle Touch is really great for that super thin skin. And you usually have to buy this online. And it is a little bit pricier than the Hypafix, but one roll will last you a very long time. So if you are not having to use the quick clot, then you would try to actually fold that skin down so that you are going to try to preserve that skin tear. So you roll that skin down and you want to secure that in place. And you do that with something like New Skin, or you can use liquid Band-Aid. Or if you don't have either of those and you have butterfly bandages, then you can secure that down with butterfly bandages. Because you've cleaned that wound with an antiseptic, then you can now seal in that wound. And you can do that with something called Duoderm or hydrocolloid, which is available at the pharmacies. And again, this is to keep in your ready pack, okay? Or you can use something like Tegaderm. Either one of these are dressings that will keep it clean and safe. So 3M makes NextCare, and there's also Tegaderm, and you can see it comes in several different sizes. And it has instructions here on how you apply it. So with both the Duoderm and the Tegaderm, the sticky side goes down, and these are waterproof. So once you put this in place, the patient who has been affected can shower and go about life. You should not remove it, you should actually let it wear off. That can be anywhere from 2 to 4 weeks. In the meantime, if the tear came from something dirty, you need to make sure that they are up to date on their tetanus shot. If there is any increasing pain, it is going to be very important to seek out medical care for infection. If you cannot stop the bleeding with these measures, then of course you're going to need to seek out medical care. The other thing is, if you've had a hard time getting it to stop bleeding, it's probably prudent to put a pressure dressing on the site so you can use some cotton balls, you can ball up some gauze, and then wrap this around it, making sure not to wrap it so tight it cuts off circulation. So hopefully you will see an improvement, and stay out of the emergency room. And at the end of this video, we will have a list of all of the supplies, and you can choose what works best for you. You don't need all of them, but you certainly need some of them. Thank you for your time.